All right, the next fundamental sonoanatomical structure is the nerve. And just like when we studied muscle and other tissues, we must always remember the fundamental structure, how it is made up histologically and in the primary anatomical sections. So remember that the axons make up these nerve fascicles that are rich in myelin and are surrounded by a perineurium and an epineurium, which are more fibrous tissues. Therefore, they will also have anisotropy, but much less than tendons. Notice that this structure is very similar to tendons, but because of the tissue composition, which has more fatty component from the myelin, it won't be as anisotropic as tendons, which are tissues rich in fiber and in fibrous tissue without so much fluid. So it's very similar. However, we'll see that there are some clearly definable characteristics. The honeycomb pattern is typical in ultrasound images, or some people call it a mulberry pattern. Let's look at them here. A honeycomb pattern, which is basically in the transverse view, those fascicles that are rich in myelin, so they're more anechoic, with some epineurium and perineurium that are more fibrous, more hyperechoic in our nerve in the transverse view. In the longitudinal view, notice that the fascicles, unlike tendons, have much more anechoic or hypoechoic content because the axons are rich in fatty tissue. This is a nerve in longitudinal and transverse views, the honeycomb pattern and the tubules in longitudinal, which are much more rich in hypoechogenicity and alternate with hyperechogenicity. Nerves, another fundamental structure that we have just studied.